Good morning, everyone. Thank you for joining us this morning. On Friday, September 20th, 2024, the Premier and the Minister of Finance, the Honorable David Burt, shared some wonderful news during the government's mid-year budget review. And as such, he announced that a generous $25 million support package aimed at addressing some very critical public needs. I'm pleased to say that a key feature of this package involves the sum of $2.29 million investment in a comprehensive mental health support program set to run until the 31st of March, 2025. And this is truly wonderful news for the people of Bermuda. At the Ministry of Health, we want to ensure that mental health concerns are met with understanding and compassion and not stigma. And we want everyone to have access to the support that they need. Mental health challenges can strike anyone, anywhere, or at any time. Globally, 1 in 4 individuals will face a mental health issue during their lifetime. And tragically, stigma and discrimination often stand in the way of individuals seeking to get the help that they desperately need, resulting in unnecessary suffering and delayed recovery. The Ministry of Health will continue to work hard to dismantle these barriers, foster a culture of empathy and support, and ensure that everyone feels understood and has the access to the care that they need. Additional funding will significantly bolster our efforts to support mental health initiatives. With more resources, we can expand our programs, reach more people, and provide even better care and support. So today I'm excited to share the vision with the Ministry of Health for a healthier and more supportive community. While the full details of the programs will be shared with you in due course, I'd like to give you a brief overview. With funding from the Ministry of Health and in collaboration from our many dedicated partners, we are launching a range of initiatives designed to care for the mental well-being of our entire community. We will soon introduce a comprehensive mental health awareness campaign aiming to break down the walls of stigma and discrimination and encourage people to seek help without fear. We will also roll out a suicide prevention strategy because saving lives through both protective and preventative measures is our priority. We also recognize the power of community. And that is why we are introducing a community outreach program to engage local leaders and provide critical information and resources directly where they are needed most, ensuring that everyone in our community feels seen, heard, and supported. And I'm equally excited to announce the National Health Advocacy Program, which builds on successful global models, but it will be tailored specifically to Bermuda and our needs. From mental health literacy programs in our schools to national conferences and training for mental health first aid, we are dedicated to equipping people with the knowledge and the tools that they need. Our work doesn't stop here. Through the Mental Health Gap Action Program, it's led by the Bermuda Hospitals Board, we will integrate mental health into our primary care, making support more accessible to all, especially in the early stages when it is needed the most. And we've not forgotten our young people, because our future, they are our greatest responsibility. And we understand the challenges that they face and are deeply committed to providing the support that they need. And that is why we are introducing a school-based health behavior intervention program designed to nurture their well-being where they spend much of their time. In addition, we will be hosting a Youth Mental Health Summit, a space for our young people to come together, learn, grow, and be empowered with the skills and resources that they need. We want them to know that they are not alone and that they have the tools to support one another and themselves. This is all about building resilience and fostering understanding and ensuring that every young person knows that there is help, where to go and to get that help, and that there is hope and that the community is ready to lift them up. We are also grateful to our incredible contributions of our community partners, organizations like Age Concern, the Family Center, the Women's Resource Center, and Teen Services. We will continue to support their vital work with funding that expands their impact. And finally, We are strengthening our own capacity by hiring more staff and creating an emergency fund for those complex cases where mental health and social support must come together. We now have significant additional resources to tackle mental health throughout all segments of our community. And as the Premier said last week, we can confront the growing challenges of mental health and ensure that mental health resources are more accessible and that the support is available for those who need it, helping to reduce stigma and provide healing within our community. Thank you.
Thank you, Minister. We'll now take questions from the media, starting with Benita Barker.
Thank you, Minister. You've listed a raft of initiatives there. What is the first one that the public can expect to see rolled out?
Well, one of the initiatives that we spoke about was to encourage more community engagement, and that we will have a training session. We had one last year, actually, where our community adolescent mental health team went out to the community and taught them resources about risky behavior, what to look for. This is for our adolescents, what to look for with respect to mental health challenges, where they can receive support, and so forth. And we actually have one of those scheduled, I think it's in 2 weeks' time, and there's over 30 guidance counselors that will come together with professionals locally and overseas to help them to, again, draw more community support and initiatives as it relates specifically to our adolescents. We also will immediately start our campaign as it relates to anti-stigma. We know that stigma and discrimination, regrettably, are one of the biggest stumbling blocks for persons to receive early treatment and access to mental health services. So we will be going out full frontal on that really, really quickly, because that's critically important.
Okay. And you said the funding would help support, a wider mental health program, and you listed an end date. Was that March 2025?
That's with respect to this particular budget. So the 2.295 will carry on to the budget 25-26, so the end date will be next year. However, we have been assured by the Minister of Finance that that 2.29 will be added to our budgets for next year moving forward in 25-26.
Understood. So do you expect some of these initiatives to kind of remain as a mainstay in your calendar going forward?
Absolutely. Again, we've been assured that that money will remain within our budget. So the programs and the initiatives that we're starting on now, some of which are being built, we are building on existing initiatives, and this money will allow us to further those initiatives and provide further care and support to members of the community that need it. But it is anticipated those initiatives will continue to run into 25-26.
Thank you.
Thank you. Thank you, Minister. We now invite the Minister of National Security, the Honorable Michael Weeks, to share his initiatives with us. Thank you.
Good morning, everyone. I am pleased to announce that the Ministry of National Security has been allocated an additional $5.4 million for the 2024-2025 fiscal year. This substantial investment allows us to expand and enhance programs that will directly benefit our communities and improve the quality of life for all Bermudians. One of our primary focuses with this extra funding is to empower our youth, especially those involved with the Gang Violence Reduction Task Force outreach program. We are dedicated to providing opportunities for them to advance their education and develop vocational skills. For participants nearing the end of high school, we will offer assistance to help them obtain their GED within the next academic year. Those who meet the entrance requirements for Bermuda College will receive financial support to cover tuition, fees, books, and materials. We are also expanding training options to include apprenticeships, local certifications, and opportunities for overseas training. Our aim is to open doors for individuals seeking positive change. By investing in their education and skills, we empower them to build more secure futures for themselves and make meaningful contributions to our community. The ministry is expanding its coordinated crisis response team to provide more timely and comprehensive assistance to individuals and communities affected by violence. By expanding our capacity and resources, the team will be better equipped to offer prompt support and a broader range of services during crucial times. In addition, we are expanding the community counseling program to offer more personalized support to those impacted by violence and trauma. Recognizing the profound effects on families, children, and victims, this program provides access to trained grief and trauma counselors for a series of individual and group sessions. It is crucial for the overall mental and physical well-being of our people that we address the emotional and psychological needs of those affected by violence. We aim to foster real healing and recovery within our communities through these support services. We are also launching an individual counseling program to provide personalized support for those affected by violence. There are hundreds of people on our island who are dealing with the trauma of violence. These sessions, lasting between 10 to 12 weeks, will offer weekly one-on-one counseling aimed at mental and emotional health recovery and reintegration. On average, we experience 20 violent incidents per year, each impacting about 10 people, including family members, children, and close friends. Furthermore, we are introducing a family counseling program. These group sessions are designed for families who have lost loved ones or have members involved in gangs and need more impactful and meaningful support. The goal is to strengthen family bonds and provide collective healing through group therapy to help families rebuild their support networks and, by extension, improve their familial wholeness and stability. We are providing additional funding and support to existing community outreach and school programs that serve at-risk youth. Our objective is to strengthen these programs so they can deliver higher quality services and expand their product. In our schools, we are increasing funding for assisting violence prevention and personal development programs, allowing the Gang Violence Reduction Team to improve its delivery and reach more students, including those that are not involved in antisocial behavior. We are also supporting ongoing student engagement, encouraging leadership and peer mentorship in violence prevention and conflict resolution. For community outreach, we are enhancing support for organizations that work with youth, such as sports and community clubs, for after-school programs to improve their current offerings, whether through enhanced resources, staffing, or materials. I am also pleased to announce that as part of our commitment to addressing substance misuse in our community, we are allocating additional funding to the Department for National Drug Control for important grants to both Pathways Bermuda and Focus Counseling Services. This funding will enable the National Drug Control to offer more support to essential substance abuse intervention programs. Focus Counseling Services has been a cornerstone in providing comprehensive support for individuals in recovery. This additional funding will allow them to sustain their operations, particularly in their supportive housing initiative. By ensuring that these services continue, we reaffirm our commitment to those who are seeking recovery and healing. Meanwhile, Pathways Bermuda plays a crucial role in connecting individuals with international treatment centers and local addiction professionals. Their approach focuses on providing holistic, sustainable pathways for those affected by substance misuse. With this funding, we will be able to enhance their capacity to offer treatment, aftercare, and group programs, ensuring that Bermuda residents receive the appropriate level of care and support. This investment not only strengthens our existing initiatives, but also reinforces our collective responsibility to address the challenges of substance misuse in our society. Together, we are taking significant steps toward building a healthier and safer Bermuda. All of the initiatives I have outlined represent the government's dedication to making tangible improvements in the lives of Bermudians. By focusing on education, rehabilitation, and comprehensive support services, the Ministry of National Security is actively working towards enhancing the well-being and safety of our communities. Thank you.
Thank you, Minister. Right now, we're going to invite questions, beginning with the Royal Gazette.
Good morning, Minister.
Good morning.
I am Alva Solomon from the Royal Gazette. I have two questions relating to the budgetary allocation. One is on the CCTV nationwide system. Can you say when that will be implemented fully and what the additional funding is for?
Well, in this presentation here, we didn't mention CCTV, but CCTV is well on the road. I think we are about 80 to 85% complete, and we are looking to have it fully operational shortly.
Okay, another question, but I don't think you mentioned that. It has to do with the police service. Can you say, like, what is being done to recruit more locals to join the police service?
We are definitely in the process now of taking a look at our recruitment process to bring it into the 21st century. And hopefully, once we are finished with the recruitment process, that will make it a little bit easier to hire locals first.
Okay, my last question is on the initiatives that you mentioned to address gang violence. Would the ministry be collaborating with the Ministry of Health and Education to address violence in schools? With youths, among youths?
Well, most definitely. This government is a joined-up government, so the Ministry of Health, Ministry of Education, Ministry of National Security always collaborate when it comes to improving the lives of our youth.
Thank you.
Thank you, Alva. Right now, we'll turn it over to Bermuda Broadcasting.
Thank you, Minister. Elisa Bernardo with Bermuda Broadcasting.
Morning.
With this additional boost of funding, what would you say are the top priorities for you?
They all are important, but one of the things that we are doing is expanding the counseling services to those that have experienced trauma and violence in our community. So I find that very high on our list. And also assisting the sporting clubs in some of their outreach programs to our youth, because what's important is that if we could prevent violence and antisocial behavior, then that is something that I'm also looking forward to.
Okay. And you noted that high school students may be eligible for financial support to attend Bermuda College. Can you explain the amount of the scholarship funding that would be available for each student?
Well, the funding that has been provided is an overall increase in services that we are offering. So if somebody meets the criteria and is going to Bermuda and makes it into Bermuda College, then we will provide the funding. I don't have an exact number of each student, but we will make sure that they have the funding necessary to enroll in the Bermuda College.
Thank you.
Thank you.
Thank you, Minister Weeks, and to Minister Wilson for your presentations. That concludes today's press conference.
Thank you.